so that physicians can come together and get data that will be able to answer those questions that you ask. And if we answer those questions, we therefore able to formulate our policies. We're able to put our resources in place so that we target the high risk groups. We're able to do research, and we're able to give better quality care to our patients.
Now, do you also work with the pathologist, for example, to say, okay, well, those cases that you miss, people who have died and suddenly and no one understands why that person has died, and later on it is determined that that person has died of cancer. Is there a close relationship between you or the hospital and the pathologist to say, okay, well, we missed so many cases for the month or for the year?
Well, the pathologist is at the core of cancer management. In fact, an oncologist is only able to treat a patient in a legal setting once he has a diagnosis that is confirmed by a certified, registered, licensed pathologist. And certainly this is an essential aspect to our management of cancer patients once we get a proper diagnosis. So that at the point of diagnosing, the person is still alive. And you're referring to the point where a person has had a sudden death, and it might be as a result of cancer. So certainly the pathologist's role is very crucial in the whole management of a cancer patient.
I'm talking about it, and I'm thinking of some of the photos that I saw, and I just want to advise our viewers this evening that we might be showing some, or we will be showing some graphic images. So we're asking you, advising you to exercise discretion when you're viewing, because some of those images might be very disturbing as we try to highlight the scourge of cancer on our society. Breast cancer, pink ribbons, pink lids. If you like me and you watch the NFL, you see these tough guys and they have their pink boots and their pink gloves and that kind of thing. Yeah, it happens every October, and it is for breast cancer. What are we doing as a country to reduce the incidence of cancer?
Well, I mean,
or probably a better question should be, what should we be doing?
Well, I can tell you what we've been working on, and we've been working on these things in collaboration with a number of stakeholders. For instance, the St. Lucia Cancer Society over a number of years have been, at the forefront of cancer education, and a number of other cancer activities through health fairs and supporting cancer patients both financially, emotionally, and otherwise. We've also started working with the Faces of Cancer group, which is a group of cancer survivors in the main, who look to providing that kind of psychological, emotional support that cancer patients need, as well as financial support. So recently, Faces of Cancer hosted a breast screening health fair at the Derek Walcott Square, where women were invited to have breast examinations by physicians, and those women who were with suspect conditions were given free mammograms so that you could be screened for early lesions in the breast. At the same time, we've been working in conjunction with the Ministry of Health and the Bureau of Health Education, where a number of activities have been put together, including talk shows on radio, television talk shows. A number of in-house screening activities are planned. We also have associated with the number of corporate groups who have been part of the whole cancer awareness project for over a number of years. And it's about sensitizing people, creating that kind of environment where people are educated and develop the skills for breast self-examination and know how to access care in a proper and efficient manner.
What should one be looking for as far as cancer, or does it manifest in many different ways? You see a bump and it doesn't go away and it grows. Is that something that that should concern you, or I mean, cancer. It's to me still it's still a mystery.
Well, the World Health Organization puts out something called 7 warning signs of cancer, and a lot of it, really it's about changes in your bowel and bladder habits, a sore that does not heal, any discharge from any part, a lump in the breast, a mole or wart that changes in color and grows and so on, a cough that is changes and becomes worse and is persistent. So there are a number of bloody discharge, there are a number of things that occur that are alarm signs for cancer, and certainly it's a flag to see your physician and see your nurse as soon as possible, so that an early intervention can assist in maybe getting a cure if it were the case, and so on.
I think you're scaring a lot of people out there. That the list of 7 that you just
yes.
highlighted there. Many people are saying, "Oh well, probably I should check my physician because, yeah,
Yeah.
I have one of those symptoms." We're due for a break right now. You're watching Newsmaker Live. With me this evening is Dr. Owen Gabriel, and we're discussing cancer because this month is Breast Cancer Awareness Month, and we, as well as the rest of the world, are coming together to observe breast cancer awareness. So stay with us. We'll continue. Later on, we'll take your calls.